Hello, and thank you for downloading NACHO's Beacon Communities Program podcast series. The Beacon Communities Program is a grant program for communities to build and strengthen their health information technology infrastructure and exchange capabilities. These communities will demonstrate the vision of a future where hospitals, clinicians, and patients are meaningful users of health IT, and together the community achieves measurable improvements in healthcare quality, safety, efficiency, and population health. Today I'm joined by Daniel Jensen. He is the Associate Director of Olmsted County Public Health Services in Minnesota, focused in the areas of aged and disabled programs, WIC, and public health informatics. In the role of informatics, Mr. Jensen serves as Lead Public Health Technical Advisor for the Southeast Minnesota Beacon Program, Project Manager for both PHDOC 2012 and PHDOC Beacon projects, and is an active member of the Minnesota State Community Health Services Advisory Committee, HIE Work Group. Thank you so much for joining us today.
Thank you for inviting me.
So the first question we have for you today is, what should local health departments know about their beacons, and what kind of services can they provide?
Beacons collectively are working on improving the health information exchange capacity with across the United States. So specifically, they're putting together infrastructure from a technical standpoint in order to exchange health information for specific patients. But more specifically, as we start to work with these populations and understand them better, we are initially starting from the Beacon perspective to focus on diseases such as asthma and diabetes. But as that groundwork gets laid, it's going to be expanding into additional areas that will include areas of population health that public health normally works on.
And as an individual who plays both roles, being part of a Beacon community and an associate director at a public health agency, what are some tips that can make local health departments work with beacons?
From my perspective, I believe it's really important that local public health departments really make themselves available to be part of the solution. I think when voices can be heard that represent the community perspective, along with the clinician and medical professionals that are working in a hospital environment, that community perspective can really help to improve the workflow processes, can really help people to understand where transitions of care should move to create better and more useful use cases. Those use cases can then be used by the technical teams within Beacons so that they can start to make transitions within the technical infrastructure to be able to better exchange data. Maybe to provide an example around that would be helpful. Some of the work that we've done with engaging the local school districts in bringing them to the table to talk with Beacons, the Beacon project in southeast Minnesota, we found out that initially we thought that we would exchange the asthma action plan and make that available to all members of the school. So that would include the school nurse, that would include coaches, teachers, those types of individuals. And the response that we received when we were able to connect a community perspective back into the discussion was that they were very, very excited that we could have that data made available in the schools to help improve the care for their children. However, they were deeply concerned about that data being made available to non-health professionals, such as coaches, such as teachers, without it being vetted through and explained by the public health nurses or the school nurses that were available there in the school. So the comfort level was basically, I want to make sure that these people that haven't had training, such as medical training in these areas, are really understanding what this means for my child and not necessarily taking them out of sports and not allowing them to participate. So that community perspective allowed us to change some directions where we were planning on building systems that would release it more broadly, where we really narrowed that scope to only release it to the school nurses and the public health nurses that work within the school environments.
How large is your community?
We are looking at southeastern Minnesota, and that includes 11 counties and 11 public health districts, 3 medical area providers, Mayo Clinic, Olmsted Medical Center, and Winona Health Systems, and about 47 school districts. Specifically, Olmsted County, that population being the largest single county in that area, is about 150,000 residents.
What do beacons see as their potential role with local health departments, and in return, what should local health departments see as their potential role with their beacons?
Really, the importance is to make sure that there's a voice in the room to improve the relevancy of the actions that are happening. The example that I gave that was very specific around the asthma action plan being exchanged, that allows us to make improvements across individuals that collectively make improvements to health at a population level. Public health departments work a lot in that area. So the work that public health departments do that's really focused around the larger population health is really at a policy development level. That policy development level can include things like being able to do field to school type work within the school lunch programs, being able to do built streets within the complete streets initiatives within the communities. Those complete streets initiatives can help improve bicycle paths, can help get people out of their cars to be able to walk more and create more livable communities. Those policy level changes, in the past, the work that we've done around that as a public health department, we've assumed that it's helped. We've been able to see maybe long term that it's been able to help, but if we're able to work within these beacons and be able to collect the data that's very specific to individual lives, we'll be able to see the impact of that more clearly, because the beacon communities are able to collect data aggregated in a community from a community setting and in a CDR type model, and that clinical data repository is able to help us to understand if those types of policy changes are really making an impact in the lives of our citizens. So local public health, by becoming engaged with beacon communities, we can work within the workflows to make changes to the population health where they're impacting individuals collectively, and we can do work to be able to collect data and analyze it to understand if the changes that we're making at a policy level are making an impact to the community over time.
Daniel Jensen, thank you so much for joining us today.
Thank you.
Thank you for listening to this edition of NACCHO's Beacon Communities Program podcast series. To download more podcasts, please visit our website at www.naccho.org.